Scotland is introducing testing amongst patients with flu-like symptoms to help prevent the spread of coronavirus as 13 more British patients tested positive on Sunday. A patient in Tayside became the 13th to test positive for coronavirus on Sunday evening. Earlier, a patient in Essex became the second person in the UK to test positive for coronavirus without having recently travelled abroad, bringing the total of UK infections to 35. The case will fuel worries the virus is circulating undetected in parts of the UK, making it harder for authorities to contain the spread of the infection throughout the country. It comes as Health Secretary Matt Hancock said nothing was being ruled out, including putting cities and towns in lockdown like in China and instituting a ban on mass gatherings such as attending football matches and concerts. He admitted that scientists have told him that it's inevitable that the crisis will sweep across the world and become endemic here too. In France, the government has banned gatherings of more than 5,000 people to try and stop the spread. 3 of the new cases were close contacts of a known case which was transmitted in the UK, Chief Medical Officer Professor Chris Whitty has said. Out of the remaining 8 cases, 6 had recently returned from Italy and 2 had been to Iran. All of 8 patients, from London, West Yorkshire, Greater Manchester, Hertfordshire or Gloucestershire, are now being investigated and their close contacts traced. A vaccine is still months away from being developed. In total, 698 tests had been carried out by Sunday, up from 630 on Saturday, the Scottish Government said. A drive-through testing centre for coronavirus opened in Edinburgh on Saturday amid warnings a positive case in Scotland is inevitable. Meanwhile, the Scottish Government said that tests for COVID-19 are being increased to include a sample of people with flu-like symptoms who have not travelled to an affected area as a precautionary step. And the UK government confirmed that broader measures will be considered to keep the public safe and ensure the NHS can handle the added strain. The plans included Army-style emergency registration of health professionals who have retired, as well as relaxing rules around school class sizes in case teachers are off ill or forced to self-isolate. Other proposals include introducing emergency indemnity coverage for healthcare workers to allow them to diagnose or care for those who contract the deadly illness. Ministers are also considering whether to recommend more employees work from home and discourage unnecessary travel. Mr. Hancock confirmed an emergency battle plan, drawn up for the worst-case scenario, included banning big events, closing schools and dissuading people from using public transport. For more on this story, visit the news article link.